Genes are not necessarily my destiny, but they do tell my story.
Welcome to the Outsmart Your Genes podcast, brought to you by Sequencing. At Sequencing, we believe your DNA is the ultimate roadmap to better health. And this podcast is your gateway to unlocking the power of your genes, helping you prevent disease, optimize wellness, and take control of your future. Your DNA is not destiny. With the right insights, you can outsmart your genes and live your healthiest life. In this episode, we welcome Denise Morrow, a true pioneer in the patient advocacy space, whose diagnostic odyssey led her to uncover life-changing insights about her health through whole genome sequencing. After decades of searching for answers, Denise used Sequencing.com's tools to identify a primary CoQ10 deficiency, dramatically improving her health and leading her to launch Genetics for Health, a new initiative in collaboration with Dr. Karen Erbs to power others on a similar journey. Her story is one of resilience, discovery, and action, and it highlights just how powerful genetic knowledge can be. Let's dive in. Denise Morrow, welcome.
Thank you.
It is wonderful to see you again.
Great to see you.
Yeah, thank you. And I must say it's been a delight to keep in contact with you. I would say dating back from August of 2023, where I first learned about your diagnostic odyssey. And I think you were at that time really just at the head of making a breakthrough. And so here we are, not quite a year later, say 10 months later. Tell me how life has changed since we last spoke.
Since we last spoke, I will say that a light switch has been turned on, and the light switch has not dimmed or even shut off, which for 13 years, there was no light switch. And for 30 years, I've been very sick and not sure what was going on. So through genome Sequencing.com, I was able to find that I had a primary CoQ10 deficiency. And through that, I was able to research in the Genome Explorer tool and find that it was a specific type of CoQ10 deficiency, ubiquinol. And I was able to find and source a really pure form of that supplement. And since April of 23, I've been taking that supplement every day. And not just a light switch is on, I'm back to feeling more like my old self, and life feels like it's back within my grasp.
Amazing. And so with that, there's been some exciting developments on your side. And that's really what we're here to talk about today, is this new venture that you are now founder, CEO of, Genetics for Health, and something that you're working on in collaboration with Dr. Erbs. And so I'd really love to learn, where the idea for this new venture came from. I mean, I got a sense it's from your personal journey, but it's clear to me there seems to be, a bit of an altruist, entrepreneur, philanthropic innovator in you. And so, I'd love to hear more about the diagnostic odyssey, like all the things you tried, how you got to this solution, and, why does DNA matter? Why does genetics matter? And what are you and Dr. Erbs doing with Genetics for Health?
So to answer that, I'll go back to 2011 and move forward very quickly. 2011, I had to leave a corporate career that I loved. And I was working 70, 80 hours a week because I just absolutely loved my career and I couldn't get enough of it. And I had to leave for health reasons. There were no answers to why 6 out of 7 days, I called them spells, where I just could not function. A violent flu-like feeling, headaches, and a weight gain of 5 pounds a week. And I was a triathlete. I was a live hard, work hard, play hard, sleep hard person, and that all just vanished, and it happened very fast. So the next 2 years, I say I had to leave my corporate career to become CEO of my own healthcare.
Mhm.
No one knew what was wrong and no one could figure it out. Although I felt these lumps throughout my body and I just couldn't function. So I finally convinced a dermatologist to remove a couple of them. And great news, it's benign lipomas. But why do I have hundreds of them? And what happened? What hijacked my life is really the question.
Mhm.
And it took me 2 years from 2011 to 2013 to actually stalk Dr. Erbs, who through my own research I found specialized in something that I thought I might have called Derkum's disease. And I did my own research. I followed where she was to where she moved to Arizona to open this practice. And she diagnosed me in 2013 within 5 minutes. And from that moment on, I would see her twice a year. And she started giving me nuggets of information to try to improve my health, which was not, oops, sorry, that thing is going off. It'll go off for another minute or two. Hold on.
That's okay. Yeah, tricky time. You know,
One.
we could cut that out, but I think it's just too authentic. We must leave it.
Okay, that's fine.
Yeah.
The cat will be happy to have a bit part.
The cat has a cameo.
Yeah. So Dr. Erbs confirmed it. And each year I made painstaking lifestyle changes to this is considered also a lymphatic condition. And that was why I was so sick, is these tumors throughout my body were interfering with lymph drainage. And that was backing up, and my toxins were not leaving my body. And that's why I felt like I had the flu. And I went through lymph drainage. I changed my diet to all organic and proteins and vegetables. And for 1 year, I was able to get most of the 60 pounds off. And to this day, I still have to do things daily that no one needs to think about. No one else, unless you're in this rare disease community, needs to think about making sure you drink enough fluids to flush your lymph system and dry brushing and doing all my own manual lymph drainage. So my life has become more focused on medical, and it has been ever since I was flattened in my own life. That led to Dr. Erbs and I having a lot of conversations over the years as I was her patient. And although I made all of these lifestyle changes and things improved for a while, it started to halt again, and it never improved to where it was before. And in 2015, I got my first autoimmune diagnosis. And then in 2017, as I kept getting sicker, Dr. Erbs suggested I have exome testing done. And the exome testing showed something that had really nothing to do with my diseases. And in 2019, as I kept getting sicker, she said, we need to get your data and look at your data. And I was able to get a filtered variant list from the genetic company. And it had 23 items on that list that I was not aware of. And that's what started the genetic spark for me, is if this is my data, and there was a short list based on my geneticist taking my family history, my history, and I was only given one variant that really had no impact on my life or where my life might be headed. That just didn't sit well with me. And so then through that list of 23, I was able to filter this in and say, wow, there's a couple things on this list that feel even more, likely to be at the root of a lot of my health issues. And so in 2019, Dr. Erbs says, you're not getting better. You're doing everything. And the short list has some pretty significant things, but maybe we should do full genome testing, and maybe we should get your parents involved in that. And I'm fortunate that my parents were willing to do that. And that came back in 2022 with a really rare variant. Only 7 cases in the country. 7. I'm number 8. My mom is number 9.
Mhm.
And at this point, I'm still feeling like, well, this is still my data, and all I have is a single report. And when I try to get the data, it's nothing that I can work with because it's a geneticist tool that an individual, I love the word you've called me before, which is citizen scientist. I'm just seeking to understand my own body, my own genetics, my own health, and I can't. And I'm a researcher at heart. So that's when I found Sequencing.com. And although I have all this prior genetic testing, I don't have a lot to show for it other than a few hard copy reports.
Mm.
So your tool, Sequencing.com, is the most empowering thing since I found Dr. Erbs in 2013. And my life was hijacked in 2011. And I knew there had to be more of a root cause, a root, or, like peeling the layers of an onion. There's more to my story. Genes are not necessarily my destiny, but they do tell my story. And now for the past 2 years, I have basically lived in Sequencing.com, the tool, because I am finding things that have restored what I will call genetics for health, was birthed from. I was able to find my own primary CoQ10 deficiency, which flipped the switch on to bring me back to a semblance of life with I could get up every day, function every day, and really research every day. And so Dr. Erbst has been very, I would say, intrigued that I was able to figure a core deficiency out that I was born with. Also, that this shortlist had a immunodeficiency that I was born with. And so through our conversations, does this rare disease, Derkham's, have an immunodeficiency at its core? Maybe, maybe not. And so this started Dr. Erbs wanting to also seek to understand for herself and her patient group. So we have launched in our minds, and now in reality, this is powerful. This is how we figure out rare diseases that have hijacked lives. And if my saying has been, if cold case crimes can now be solved with DNA, how come cold case medical odysseys can't? And I truly believe they can. So Dr. Erbs and I have now been discussing this a lot because a year ago she presented my case at her annual conference. And this year at the April conference, I told my story.
In which conference was that?
The FDRS, Fat Disorders Resource Society.
Right.
And there were hundreds of doctors and patients there. And I will say, since that presentation a year ago and the one this year, neither of our lives have been the same, Dr. Erbs and mine, because a lot of patients and doctors are feeling the same way.
Mm.
There are answers in our genetic story, and that unless we start to unravel that, we can't get to the core of some of the rare diseases and illnesses that are affecting humans everywhere.
It's when you, I think, look at the metadata, I think the number is around what, 7,000 rare diseases globally, 300 million people afflicted that we know, by the way, like, and you mentioned this term diagnostic odyssey. So there's probably a good chance there's a number close to that that's walking around in pain and don't know why. And then not to mention that, as you said, in the case of your family, like this becomes a family objective to solve for. So,
Yes.
even if it's one child in a family of, say, 3 or 4, that affects all 4 people. If I think about our founder and CEO, Dr. Brandon Colby, who I know you're familiar with,
Yes.
he himself was born with epidermolysis bullosa simplex, which is a rare genetic disease. Essentially makes the skin ultra sensitive to temperature, and so blisters at the slightest touch. Holding a tennis racket or going for a walk, and this was something that, well, he knew what the disease was, but he didn't know the root cause, and in fact, it was really his life mission to understand genetics and help, all people outsmart their genes. And really it wasn't until we got to, whole genome sequencing and the application that he built, next gen rare disease screen, it wasn't until that was all built that he learned he was actually, a homozygous recessive carrier for the gene, which, has huge implications in terms of how he might proactively, plan his family, as an example. So it's all, really amazing. It's critical information. And, while rare disease has the spotlight, in a way, the way that we are put together is so unique, right? And I was actually just speaking to a university professor, Dr. Smith in Louisville, Kentucky, who was talking about the genetic variation of different genes associated in the immune system, and so how that is going to affect, well, our autoinflammatory responses, our responses to vaccines, and there's this whole new literature that's opening up in terms of precision medicine. And interestingly, it's the promise that Bill Gates made, back in the late 90s or the 2000s, echoing the sentiment that the human genome is our shared heritage, but also our shared legacy, and not just individually, but collectively. So like the individual human, yes, humans, yes, and families, but all of humanity. And so, I was really intrigued by your story because, you're really at the tip of the spear where the solution is critical. Like it must come. It literally is life or death. And so, I hear your story, and my motivation for getting it out is like, wow, there's got to be listeners who hear this, who may have specifically your disorder or some other rare disease, or just to know that whole genome sequencing is now accessible and is affordable. By comparison, the first genome cost $4
Yes.
billion to do all that research. Now you can get it for less than 400. And, effectively, you and Dr. Erbs are making this available now. So, tell me a little bit about that, because you've got you've got a doctor's network of hundreds who themselves probably have hundreds of patients. So, we're talking about your ripple effect just in your direct network. It seems to be rippling out to tens of thousands of people. You say Dr. Erbs is traveling now. We were talking at the beginning before our conversation. She's traveling to Australia. So, to tell me about a little bit about genetics for health, and your guys' vision and her commitment to bring this to her clinic, and ultimately to bring this to the world.
Mm-hmm. So, as Dr. Erbs has watched me dig deep into the genome, she has been telling a lot of patients that are sort of at the end of the road of where she's able to provide medical assistance to bring health to a better place. And one of my recent appointments, she said to me, Denise, either you have something wrong in your mind that is causing all of this, which you hate for somebody to say. And I had been labeled as somatization, where you're inventing this, or your genes are not necessarily working in your favor, right? So we need to get to the genetic part of this. So ever since that conversation, and I've been ripping and digging as deep as I can into the genetics, this has spurred for her, if I found something that no one else could, and honestly, you have to be your own CEO here. You have to do the work. Who else is invested in your story? And honestly, I think you know this because I use your tool. Some days I'm in it 17 hours a day. It's like a good book that I can't put down, and it's all about me. And I'm learning so much about me, my history of my family, and the possible future for my family, which is daunting and scary. So Dr. Erbs has been telling other patients, and other patients are now on their own doing this for them and their families. But then it's, all right, well, how do I, with what I've learned, teach them? How does she use this in her practice? So what we have done is collaborate for the month of April, May, and now June. She started in her new practice. And our collaboration has led us to this place. I am going to start with genetics for the number 4 health, where I'm going to work with patients of hers that want to really do the work themselves, but I'm going to teach them. And really what my goal is to do what I did for me, is look in the spots where I found, instead of boiling the whole genome ocean, there's a sliver where things live that I have been able to invent on my own through my questioning and my research. Things like, let's look at core deficiencies and see what you have. Because at the core, someone else might have a CoQ10 deficiency or another deficiency. My goal in working with them, and I am going to pursue my patient advocate certification to help this patient population of hers, is to bring them to base health. That's what Genetics for Health is. I want to help individuals scrub their own Sequencing.com genome, looking for the things that I was able to unearth in mine, and help them understand, do they have any rare genetic variants in common with the ones that have been found that are implicated in my illness? And it's the FAS gene for me. And look at that. And if so, we're also trying to research the broader, could this contribute to Derkham's disease or fatty tissue disorders? And Dr. Erbs is very committed to this because at some point, she's also come to the place that this is very hard to solve and it affects so many individuals. And now when I do what I do, then the intent is there's a merging of our two pieces of work. And Dr. Erbs, as a clinician, will take the genetics for health baseline, and hopefully they've been able to find something that turns their switch on so they can do the rest of the work and bring in the kinds of things that we want that individual to bring, because we've got lists now of these are the gene families that you should scrub your data for. And then she will be able to take that to Genetics for Better Health to take them to that next level of health. So I'm almost the basement level up to maybe ground floor, and hopefully she takes them from ground floor further. And that the way to get answers to each of our unique genetic odysseys, even though we have in common maybe Derkham's disease, maybe there's immunodeficiencies in some, but maybe not in all. It's to further the research. Lipedema falls into this space. And I think in a conversation we had with her, she mentioned 1 in 9 women have lipedema. It's a very serious condition and it affects everyday health. There are things that at a broader scale, if we could figure them out, would be great. But it's also about helping each individual on their personal health journey. And not only that, their families.
So what's the first step to you kicking this off? I know part of it is, our partnership. We're, delighted to have you as an ambassador. What is the first step for you guys to start actioning this better future?
First step is Dr. Erbs and I are running as fast as we can, because no one should have to suffer like I have for 30 years, and specifically since 2011. And this is not just my mission. I am committed. And so I'm working with a small group of her patients right now that have agreed. And then she is bringing it to her clinical practice now to any patient that wants to do this. She's starting to use it day to day in her practice. And the two of us are every Friday collaborating, because that is now part of her furthering the research. So Fridays are our days to work together on the findings. And then we are discussing having things like gene parties to compare, and in a group of individuals, really further rare diseases and finding out the clues that might bring insight to the greater of this family of issues. But it's not just that. Let's say if we find an immunodeficiency that's at the core, let's bring it to newborn screening. Let's go to the National Organization of Rare Diseases and open it up further. So Dr. Erbs is out and she's touring and she's talking about this tool. And she is world famous for this particular rare disease family. And she is really working towards, I think, bringing better health to all individuals in her practice and their families as a result. Genetic whole genome stories should be known, haven't been known. I think it's up to our generation to do the work so that the rest of our families can understand this path and not react to diseases or illness should they come your way, but be proactive in understanding that. And the answers are there, and Dr. Erbs is in her practice now and plans down the road, wants this to be part of every patient's clinical workup and trajectory for their health and better health.
So where do people find you, Denise? Where do they find you? Where do they find Dr. Erbs? I know you're like really in the beginning phases of kicking off your website, but where's Dr. Erbs' practice? Is she accessible there? Are you on LinkedIn? Are you on Facebook? How do people find you?
We are both on LinkedIn. We are both on Instagram, and I'm at Instagram genetics, the number 4 health, and Dr. Erbs is at genetics for better health. And Dr. Erbs is now practicing out of the Roxbury Institute in California, and she is accepting patients, and her patients have been waiting for her to land in her new home, and she has. And I think she had mentioned to us prior, 100 patients in the first week when she opened up the practice. She sees patients out of her Tucson office. And she also does televisits as well.
So there's 100 folks just even in the first week that we can be empowering with whole genome sequencing.
Correct.
Wow. Yeah, I think I hear you speak, and I hear the possibility for a cross-platform collaboration. I've spoken to many different advocates of rare disease organizations like United Mitochondrial Disease Foundation, Porphyria, and many more. And I think that there's a lot of overlap between the patient advocacy, patient awareness, expert practitioner awareness, and then there's an opportunity to even kick off the research side of things. And I'm sure there's going to be a number of grants that you'll be eligible to conduct a lot of these researches. So, really excited to be partnered with you on the beginning phases, really like at the grassroots. Yes. And, you guys are going to, you're going to be live in the next couple of weeks sharing your Sequencing.com affiliate page. So I'm really excited for you and our journey to get you there. Maybe just a final thought on, you mentioned the Sequencing.com tools, for the users listening, a lot of the listeners, a lot of them probably Sequencing.com users. What is your kind of secret weapon or secret approach when you look at the Sequencing.com toolbox?
Really, it has boiled down to a couple of years of hard work that I want to take away from others so that they don't go through what I learned. I want to share with them that it's a lot about searching on conditions through the Genome Explorer tool. And conditions can be your disease name, or it can be just the word deficiency. And also, it could be metabolism, or it could be absorption, because I also have some absorption issues. It could be the name of a vitamin, like vitamin B12. I have MTHFR variants, which mean I don't really get my Bs. And that's an issue. So in the rare disease families, things that I envision a dashboard down the road that would be search on immunodeficiencies, deficiencies, absorption. I have been collecting terms for a very long time, and my list is long. And I'm doing the work to look at my own and to find where maybe the heavy hitters are. The other side to that equation is, you and I have mentioned this before, but I play in the green a lot. Right. And the green is what I call the 9.8% based on the Human Genome Project. Rare diseases, which is where you know maybe what a disease is, but you do not know the gene affiliated with the cause. And the 9.8% is where I feel strongly that the rare diseases are lurking. And what that means is I'm looking for in the genome data, specifically the impact column of the protein recipe, I'll call it, where there might be frame shifts, which FS is how that's represented in your tool, and might be a premature protein termination where, for example, it couldn't, the recipe didn't get an ingredient.
Mhm.
And that is premature protein. So it couldn't create what it needed for the body to do its work. But a frame shift is more egregious because it's like the recipe just got cut off at that point, from that point on. And I'm looking for also inserts and deletes. And the inserts and deletes are where a lot of rare diseases live, according to this 9.8% that the Human Genome Project says is where most egregious diseases yet to be, unearthed live. And so I spent a lot of time not only looking at your red, which is possible disease risk for condition, and the yellow for carrier, but also in the green.
Right. Well, you've hit the nail on the head there in terms of the importance for a health scan, which is the regular updates, right?
Yes.
So,
Yes.
yeah, I mean, I think I've seen in the weekly updates sometimes as many as 1,000 research contributions. So it may feel daunting, but I think it's also really exciting because we're now starting to see the accelerated rate of discovery. And, this is right at the confluence of artificial intelligence, which you may or may not have noticed the sequencing AI kind of lurking in your user dashboard. Have you
Yeah,
noticed that?
I have. Yeah.
Yeah. And, for the moment, let's call it, it's an expert geneticist in your pocket that is more of a generalist on the topic of genetics at large, but it will become a more sophisticated application soon where you can start to have literally have a conversation with your DNA. And that's the future. And I think as we start to get better tools like that, it's going to help, the genetic counselors, it's going to help the medical doctors, and it's going to help the individual patients, all join in on the conversation of, what makes an individual unique. So I thank you, Denise. You truly are an innovator. You're at the tip of the spear in terms of where genomics is right now. That citizen scientist that that we affectionately refer to you as. We're really keen to, obviously, always keep up to date on your feedback and your perspective. Really, anybody that's listening, your customer experience and feedback is what really drives the product to, excellence. And, that's the really unique thing about Sequencing.com is, we, as we offer a subscription. And so what that means is we build our business based on the value that we deliver to customers. So this isn't about, selling data on the back end. It's really about the front end experience that we're able to facilitate. And we're able to facilitate that because of the conversations we have with you, Denise. So thank you very much for everything that you do. I would say we're here to continually support you and Dr. Erbs, and we're very excited at the initial stages of launching this partnership. So thank you so much for your time today.
Thank you. And I just must say, thank you for the tool. You have changed my life forever. And I know that this tool will change a lot of Dr. Erbs' patients' lives as well. And I'm looking forward to all of us getting genetics that will improve health and move us to better health. It is so powerful. And I wouldn't be here without you right now in front of you. Thank you.
Thank you, Denise. All right. A special thank you to Denise Morrow for sharing her incredible journey, one that turned years of medical uncertainty into empowerment and action, from using Sequencing's Genome Explorer and next generation disease screen to uncovering life-changing insights. Denise's story is proof that genetic knowledge isn't just about information, it's about transformation. That's a wrap for this episode of Outsmart Your Genes, brought to you by Sequencing. Remember, your DNA holds the key to a healthier, longer, and more vibrant life, and Sequencing is here to help you unlock it. Stay curious, proactive, and remember, your genes don't define you, your choices do. If you're ready to take control of your health, visit Sequencing.com and start your journey. Or if you've already started, please do share this podcast and resource with your friends and your family, because we're on a mission to help the world outsmart their gene.